Obstructive sleep apnea is a sleep disorder associated with snoring where the upper airway repeatedly closes when you sleep. It's a slightly unusual condition, it does need a bit of explaining. What it really comes back to is the upper airway. So your upper airway is made of either hard structures like the roof of your mouth or soft structures like the back of the throat and the base of the tongue. Now, hard structures stay in place by themselves, but soft structures are held in place by muscles. And the issue is that as you fall asleep, these muscles relax, and as they relax, your airway just narrows in on itself. Now, the first thing that you find is that your airflow will become turbulent. This makes the soft structures vibrate, which we hear as snoring. But with sleep apnea, what happens is that the airway narrowing goes even further and the airway actually closes. It's a little bit like if you've seen someone falling asleep in a chair or on a train, that they sit upright, and as they fall asleep, their head just starts to bob like this. And what's happening is that as they fall asleep, the muscles in the back of their neck are losing their tone and no longer able to support the weight of their head anymore. So it bobs and bobs, and then they do one big bob, and then they wake up again. And it's almost exactly the same in sleep apnea, except it's your airway muscles that are relaxing. Now, when your airway closes, you stop breathing. And when you're not breathing, your oxygen levels will start to drop. And your body can only tolerate this for so long before it basically sets off the alarm. It actually has to wake you up and pull you back from that deep state of sleep to a shallower state, or even completely awake, so your airway muscles regain their tone, pull open your airway, and you can start breathing again. And this often restarts with a loud snort or gasp. The consequences of this are that your sleep is such poor quality because it's so fragmented that even if you slept for even 10 hours, you would still wake up feeling unrefreshed. So this explains the nighttime symptoms of sleep apnea. So this is loud snoring, episodes of stopping breathing, or snorting or gasping in your sleep. And the daytime symptoms are significant daytime sleepiness. You can also get very poor memory, poor concentration, and often depression.